Hello everyone, my name is Justin Ernest. I work as a counselor in the student counseling department on the Oconee campus. And I wanted to share with you that 40% of students that were surveyed at UNG reported experiencing severe anxiety. Since anxiety is such a common occurrence, I thought it might be important to talk a little bit about generalized anxiety disorder, how you can recognize it, and we'll also explore some options for treatment and support. People with GAD often have excessive anxiety or worry, and they could worry about something really general. It could be a very general feeling of unease or a feeling like something bad is going to happen. Or it could be something more specific, maybe worrying about a family member's health or their work performance or school. And more often than not, people with GAD find that the worry is very difficult to control. People who have GAD are often going to feel very restless, or they're going to have a difficult time with relaxing. A lot of times they're going to feel very tired or fatigued because they are worrying all the time. And a lot of times they might have trouble completing tasks because they spend more time worrying about things than they do actually getting things done. Sometimes it's very common for people with GAD to have difficulty with concentrating or difficulty with their mind going blank. And this can interfere with their ability to get things done in a quick or efficient manner. Some other signs and symptoms that a person might have GAD is if they have a lot of irritability or muscle tension or really poor sleep quality. Therapy and medication are the two main forms of treatment for generalized anxiety disorder, but you can also help to reduce your anxiety or to get your anxiety under control by making a few lifestyle changes. A really powerful way to reduce anxiety is to work on having a really good, healthy routine of exercise and diet and sleep. So, first, I want to talk about exercise. If you can have a routine of being active most days out of the week, maybe like 3 to 5 days, this can be a really powerful stress reducer and mood booster. Getting a good night's sleep is also really important. So you want to make sure that you have a really good sleep routine where you're going to bed at the same time every night and you're getting up at the same time every day, and that you're getting a good 7 to 8 hours on average of sleep per night. And then lastly, just eating healthy, regular meals can be very helpful with reducing anxiety. A few final ways to manage or reduce anxiety would be to learn some relaxation strategies, maybe something like yoga or deep breathing. Also, learn to be present and let go of those things you cannot control. So try not to dwell so much on past concerns or things that you can't change. And then lastly, it's just important to avoid any substances that may increase your anxiety, substances like excessive caffeine use or nicotine. The good news is that in most cases, people who make their health a priority and people who work with a helping professional and those who are really consistent in making some of the recommended lifestyle changes tend to see significant reductions in their anxiety. So generalized anxiety disorder is highly treatable. Now, if you feel like you might benefit from the support of a counselor, then I encourage you to reach out to a counselor on your home campus to find out more about how we can help. Thank you for watching.